Welcome to the Business of Government Hour. I'm Michael Keegan, your host and managing editor of the Business of Government magazine. Health information technology, or health IT, has the potential to transform the practice of healthcare by reducing cost, improving quality, and enabling a patient-centered approach to care. Simply put, health information technology is just a way of collecting and moving around information. It can be viewed as the circulatory system for information. Information is the lifeblood of medicine. Health IT, the heart and arteries of that information. While health IT offers much promise, there is a need for leadership, coordinated action, unity of effort, and common agreement for this promise to become a reality. What are the benefits of using health IT? What does meaningful use mean as it relates to electronic health records? And how has the national adoption and use of health IT, especially electronic health records, progressed? What more needs to be done? We'll explore these questions and so much more with our very special guest, Dr. Farzad Mostashari, National Coordinator for Health IT within the U.S. Department of Health and Human Services. Doctor, welcome to the show. It's great to have you.
Thank you.
Also joining our conversation from IBM is Gio Patterson. Gio, welcome.
Thank you.
So before we delve into specific initiatives, perhaps you can give us a brief overview of the history and mission of the Office of National Coordinator for Health IT. Could you tell us a little bit about how it's organized and what it does?
Yeah, absolutely. We coordinate U.S. national policies and work on standards for the health information technology sector in the United States. We regulate electronic health records through our certification program. And we work with our colleagues at CMS on defining the principles and the rules behind the meaningful use health IT incentive program for doctors and hospitals and the certification criteria and standards for the electronic health records. I'm very proud of the work that these 170 dedicated public servants do every day. The office was started, and I think this goes a little bit to the point that this really has always been a nonpartisan, bipartisan issue. It was actually created under President Bush under executive order. David Brailer was the first national coordinator. When I joined the federal government in 2009 under David Blumenthal, there were 31 or 32 individuals in that office. We've now since grown, obviously, with the much greater range of responsibilities and the authorities given under high-tech. But we are still, I think, relatively small, but fulfill a key coordination role.
What kind of budget do you have?
Our budget is the same as it was under David Brailer 8 years ago. Hasn't been adjusted for inflation even. It's around $60 million. The core unique part of our mandate and what we need to contribute to the national conversation and to our colleagues at Health and Human Services is the creation of a national infrastructure that can help us learn, that can help us measure care, that can help us improve care, that can help us relate to patients, that can help us coordinate care, that can help us do population health management. Those are some of the key things that I see as being really, if we can't help provide that infrastructure, that foundation, we will not have done our job.
Mm-hmm. In a sense, I don't know if you want to call them operational challenges, but I'm interested to know, once you took the role as the National Health IT Coordinator, what are some of the challenges you faced? Now you sought to address them,
Yeah, so I took over on April 8th, 2011, and some of your listeners will remember that April 8th, 2011 was the day we were supposed to shut down the government. So first and foremost among our challenges was the tremendous uncertainty around budgets. We haven't had a real budget since then, and there's been considerable uncertainty, down month to month, week by week, sequester, impact on travel and conferences, impact on our ability to plan our investments. This has been, I think, a challenging time to have kind of a new initiative that has changing and dynamic needs, and obviously a sector where there's so much dynamism in terms of what's happening for that, and the requirement for us to keep up with that change and to adapt to it. And not having that ability to has really, I think, been a real challenge as the national coordinator. What has helped, frankly, has been that we, unlike some other countries, we didn't say we're going to buy all the IT, we're going to be the ones in the contracts, we're going to, we're in the actual putting the systems in place in hospitals and so forth. We have taken very much an approach that I think is the American approach to solving problems, which is to say that the people who make the purchasing decisions should be the people who have to live with the systems. And we have set standards, we've created certification, we've provided incentive payments, but ultimately it's the doctors and hospitals who have to buy the systems and implement them and use them. And that partnership with industry, the partnership with providers, is where a lot of this progress made has been because we have so many strong partners who are really pulling the load on this health IT journey on the outside.